If you are trying to conceive, the days after ovulation can feel like the longest days of your life. Every sensation suddenly feels important. Every cramp feels suspicious. Every change makes you wonder, is this implantation? Today, we are going to break this down clearly, medically, and completely. No myths, no exaggeration, no confusion. Just real science explained in a simple way. Let's begin. Implantation happens when a fertilized egg attaches itself to the lining of the uterus. Here's the timeline. Ovulation happens first. An egg is released from the ovary. If sperm meets that egg within about 12 to 24 hours, fertilization occurs in the fallopian tube. The fertilized egg then begins dividing into multiple cells while traveling toward the uterus. This journey takes about 5 to 6 days. Once it reaches the uterus, it must attach and burrow into the uterine lining. That process is called implantation. Without implantation, pregnancy cannot continue. Implantation usually happens between 6 and 10 days after ovulation, most commonly around 8 or 9 days past ovulation. If your cycle is 28 days and you ovulated on day 14, implantation may happen between day 20 and day 24. But remember, not everyone ovulates on day 14. If your cycles vary from 26 to 30 days, ovulation shifts and implantation timing shifts too. Implantation is based on ovulation, not calendar dates. When the embryo reaches the uterus, it must attach to the thickened lining. The outer cells begin to invade the uterine lining. Tiny blood vessels may be disrupted during this process. This is important because once implantation happens, the body begins producing a hormone called human chorionic gonadotropin, also known as HCG. HCG is the hormone detected by pregnancy tests. No implantation means no HCG rise. Here is something very important. Many women feel absolutely nothing during implantation. Implantation is microscopic. It is not a dramatic event inside the body. Now let's go through possible symptoms one by one. 1. Implantation cramping. Some women report mild cramping around 6 to 10 days after ovulation. This cramping is usually light, dull, short-lived, and not severe. It may feel like a mild pulling sensation or light period cramps. It should not be intense or unbearable. If you experience sharp, severe, or persistent pain, that is not typical implantation and should be evaluated by a healthcare provider. Important: implantation cramps are often lighter than menstrual cramps and do not get stronger over time. 2. Implantation bleeding. This is one of the most talked about symptoms. Implantation bleeding can happen when tiny blood vessels in the uterus are disturbed during attachment. Here is what implantation bleeding typically looks like. Light spotting, pink or brown in color, very small amount, lasts a few hours to 1 or 2 days. It is usually much lighter than a period. It does not fill a pad. It does not contain clots. It does not increase in flow. Many women mistake early period spotting for implantation bleeding, and many times, spotting before a period is just hormonal fluctuation. Not every spotting event is implantation, and most pregnancies do not have noticeable implantation bleeding. 3. Basal body temperature dip. Some women who track basal body temperature notice a small dip around implantation time. This is sometimes called an implantation dip. However, it is not reliable. It does not happen in every pregnancy, and it can also happen in non-pregnant cycles. Temperature remains elevated after ovulation due to progesterone. If pregnancy occurs, temperature usually stays elevated beyond your expected period date. That sustained elevation is more meaningful than a one-day dip. 4. Breast or nipple sensitivity. After implantation, HCG production begins. HCG supports progesterone. Progesterone affects breast tissue. You may notice tender breasts, sensitive nipples, heavier feeling in breasts, but here's the truth. These symptoms are almost identical to premenstrual symptoms. It is very difficult to distinguish early pregnancy breast changes from PMS breast changes. 5. Fatigue. Extreme tiredness can occur early in pregnancy due to rising progesterone. Progesterone makes the body feel calm and sleepy. However, progesterone rises after ovulation whether you are pregnant or not. So feeling tired during the 2-week wait is very common, even in non-pregnant cycles. 6. Bloating and gas. Progesterone slows digestion. This can cause bloating, constipation, gas, and fullness. Again, this happens in both pregnant and non-pregnant luteal phases, so it is not a reliable sign by itself. 7. Mood changes. Hormones fluctuate after ovulation. Some women feel emotional, irritable, calm, more sensitive. This can happen with PMS or early pregnancy. Hormones are the cause in both situations. 8. Increased cervical mucus. After implantation and rising estrogen, some women notice creamy or milky discharge. It should not have a bad smell or cause itching, but again, luteal phase discharge can also increase before a period. Symptoms that are not typical for implantation. Let's be clear, these are not typical implantation symptoms. Heavy bleeding, large clots, severe pain, fever, strong abdominal pain on one side, dizziness with pain. If you experience severe one-sided pain with bleeding, that needs urgent medical attention to rule out ectopic pregnancy. Most likely, no. Implantation is microscopic. The uterus has no special implantation alarm. Most symptoms people feel during the 2-week wait are caused by progesterone, not implantation itself. After implantation, HCG begins to rise, but it starts very low. It takes about 2 to 3 days after implantation for HCG to build up enough to be detected in blood. Urine tests take slightly longer. This is why testing too early often gives a negative result, even if implantation has happened. The best time to test is at least 12 to 14 days past ovulation, or after a missed period. Testing too early increases stress and confusion. During the 2-week wait, your body is in the luteal phase. Progesterone dominates this phase. Progesterone causes breast tenderness, bloating, mild cramps, fatigue, mood shifts. These happen every cycle. When trying to conceive, awareness increases and normal sensations feel amplified. This does not mean you are imagining symptoms. It means you are paying closer attention. Here is the honest answer. Some women feel nothing and are pregnant. Some women feel everything and are not pregnant. Symptoms alone cannot confirm implantation. Only a positive pregnancy test can. Rather than analyzing every symptom, focus on tracking ovulation accurately, timing intercourse during the fertile window, maintaining good nutrition, managing stress, sleeping well. After ovulation, the embryo either implants or it does not. There is nothing you can physically do during the 2-week wait to force implantation. The process is biological and automatic. Implantation is quiet. It is subtle. It is often unnoticed. The 2-week wait can feel overwhelming, but remember this: your body is doing its job. Whether you feel symptoms or not does not determine the outcome. If your period is late, take a test. If it's negative and your period comes, that does not mean failure. It means another cycle, another opportunity. And every cycle teaches you more about your body. If this helped you understand implantation clearly and calmly, take a deep breath. You are not alone in this journey, and knowledge is power.